worse. Red light on means. We were tabling. Cool. Senator, it's my time.
Okay, we're going to call the Health and Human Service Committee meeting to order. We want to welcome the people who are here from the County Board of Health who do so much to help us here in Lakewood. We appreciate your services so much. So I'd like to approve the minutes of the May 5th, 2025 meeting.
Second?
All in favor?
Aye.
Those minutes are approved. And I believe there's communication from Law Director Vargo.
Thank you, Madam Chair. I drafted the communication to inform Council that we have a renewal agreement request. The renewal is with the County Board of Health for the regulatory work they do and the registration work they do with our retail establishments in various sectors. And we invited representatives of the County Board of Health here tonight to answer any specific questions this committee would have.
Thank you, Director Vargo. And just for a little background in history, for those who may not know, the City of Lakewood used to have its own Board of Health, which was disbanded many years ago, and now those duties are assigned to the county, so they help us out with many different areas within the city, and they're going to give us background on that and some statistics on what they do.
That's right, Madam Chair. Thank you for that. And just for more background, when you get to cities of our size and similar size, state statutes allow the city to have their own Board of Health or to combine with other cities with the county. And we have found that that synergy with the county is far more efficient for our city. And that is the norm across Ohio of cities of our size and smaller.
Right. Thank you. That's very true. We spent a lot of money that we didn't need to, well, or that they're doing a better job than we could do on our own, so we appreciate the county. So I'll turn it over to the county. If you want to introduce yourselves.
Good evening. My name is Suzanne Rush. I'm the Director of External Affairs for the Cuyahoga County Board of Health. Madam Chairperson, other chair people and members, thank you so much. Mr. Varga, thank you for having us. I'm here with our legal counsel, John Mills, and our Director of Environmental Public Health, Mr. Matt Johnson, my partners, and they work with me at the Board of Health as part of our senior leadership team. We appreciate your kind words and the fact that you recognize that combined, we are doing a fantastic job serving the 58 communities other than the city of Cleveland. They have their own Board of Health that serves them, but we handle the other 58. It is no easy task. We're about 188 people strong at the Board of Health, and 3 people, their full-time job would be working in your city, and that would be in the environmental public health. The rest of us work in the periphery, little bits and pieces of our job, but a few communities combined for a person who works in food, a person who works in district, and a person who works in water, and I'll explain those briefly. The food protection person does anything that sells food, whether it's a bowling alley, a grocery store, a school. If they sell food to people, they would be in there doing that inspection. A water person does everything watershed protection, from anything to do with a beach or stormwater or sewage or septic or a complaint about any of those things, or anything to do with groundwater being contaminated. We know you're a very sustainable city, and you have a lot of programs that coincide with what we do on the watershed protection type thing, including things around trees and things around green space. You guys are phenomenal. You're kind of our gold. You and Cleveland Heights are our gold standards. We point your 2 cities out all the time and brag on you guys for the great work that you do. The other person that works in district does pretty much everything else. Like just today, we received a complaint about a street, a Bays Avenue residence having sewer rats. So our district sanitarian, Mr. Johnson, is already on it. He's already referred that to a district sanitarian who'll be out to serve. So those are just in the environmental public health. And before I leave today, I want you to all have, and we'll leave these with you, brochures that talk about all the service areas. Environmental is just one of the programs we do. We have population health, which works more towards chronic disease prevention, things like heart disease and sedentary lifestyle, things like healthy farm-to-school initiatives to get kids eating healthfully as young children so they learn it all the way up. We used to work closely with Nature's Bend. When they were here, we cried a little bit when they closed because we did so many programs for special needs folks and so many programs for kids who really didn't know about eating healthfully. And we want to do more of that. We are working with your YMCA on some of those programs now and trying to get more into schools. We're working on that. But the idea is population health helps combat chronic disease, where the folks over in our nursing and clinical services helps to combat acute disease. And they do this by all sorts of health screenings and checks, all sorts of STI testing for sexually transmitted infections. We do have a clinic here in your city, and we ran some numbers on it. In 2024, they saw 79 patients with 122 visits. In 2025, 67 patients with 106 visits. Anyone can walk into our clinic and get a flu shot. Anybody can walk in and get an immunization if we carry them and we know that they're coming. If not, our main campus, which is in Parma, or our east side location, which is in Warrensville Heights, they can come to by making an appointment with us. It's in, what street is on in Lakewood? I apologize, I don't remember. I want to say it's where the old clinic building used to be, so it should be that way on Detroit, I believe. It's right by an Einstein Bagels. It's like a block away. I don't know the answer to that. I've never been to the Lakewood location. I regularly go, I'm an East Sider. I regularly go to the East Side location, but I've not been to that one, so I apologize. But I can get you the street address. Thank you. But the idea is chronic disease prevention, again, with population health, whereas acute disease prevention and also regular immunizations and vaccines that happen through our clinics. We do not see the traffic to be perfectly transparent, and one of the reasons that we want an increase, a 12% increase for 2 years, we have just launched a mobile medical unit. We got that mobile medical unit with dollars from COVID, but we are putting it to use going forward for all chronic and acute disease prevention. Because even though we only focus on reproductive health and STIs, our other groups and services that focus on things like chronic disease prevention can still use that as an attractant to get people to come in. For example, if I'm just standing at a little table at a fair, I might get 50 or 100 people at a big event to come by me. But if I've got this big, new, shiny vehicle that nobody's ever seen, they're going to come there and listen to that messaging, whether it's how to wash the hands properly, whether it's anything to do with nursing or baby latching on with maternal and child health, which we do in population health, whether it's cardiovascular wellness and stroke prevention. We are partnering with lots of hospital systems because, again, we have this many resources and this many people to help, so we're partnering with UH, we're partnering with Metro, we're partnering with Cleveland Clinic to get more manpower. They have dollars they have to spend, we have the need. So we're trying to do both. And every time we talk about health equity, people lose sight of what that really means. It doesn't mean if I have enough money to give everybody $50, I give everybody $50. That's equality. We give the people that need it most, that truly need it most, the most care and services because they don't have insurance. They are underinsured, undercared for. And that's really the focus of what we do. But that mobile medical unit is going to be huge. We do a thing called accreditation through the Public Health Accreditation Board, and that's what is the gold standard for boards of health, and we are already accredited. We have just filed for reaccreditation, and this week we should hear that we got that approval. We're counting on it because when they came to do our summary and our follow-up, they had nothing to tell us that we had to change. They were like, we're good. You just have to wait for the hearing. So I think that's this week, if I'm not mistaken, either this week or next week, but right before Thanksgiving, we're supposed to hear and get another plaque and say we're reaccredited. That is a huge undertaking. It is what compares health departments across the nation apples to apples to make sure that we're qualified for the monies we receive and we're doing the work we need to do. We have to give all sorts of evidence. The point of that being, we're not just taking money and going, yep, we're doing work. Yep, we're doing work. We have to prove health outcomes by the work that we do. Every day, the work we do, our health commissioner is charging us with, at the end of the day, what health outcome is improved because of the work that you've done. And I think in the past, way back when, even before when Lakewood was its own, when I started and when Matt started, Cleveland had their own Board of Health, so did Cleveland Heights, East Cleveland, Lakewood, Shaker, and then we did the rest. Those all have been absorbed except for Cleveland. And each time, our health commissioner asked us to be more efficient, more effective, and do more with less people. When I started, there was 260-some people with all the nurses that we have. We're down to 188. We're doing 15 or 20 more programs than we did then. We have to be more efficient. We have to be more effective. So part of accreditation says you must go out and do a community health needs assessment and then create from it a community health improvement plan. And we did that work. We hired outside agencies to help us, and we did it, and we asked from each community. And this is what we heard over and over. You're not communicating with us enough. You're not engaging us enough. We need more communication, better engagement. More communication, better engagement. We heard it over and over. So these are the things we've changed. We've created a position that I do, which is external affairs, and you'll get a stack of my cards before I go. Any public event that you have where we're tabling or we have an opportunity to speak like this or offer a presentation, we want to know about it, and that's my job to coordinate that, make sure experts. Now, we're honest. If you come to us and you say, we want an expert in lung cancer, unfortunately, we don't have an expert in lung cancer, but our friends at WellLink do, boom, I will connect you the same day with somebody who has it. If we don't have what you need, we will be the conduit. That's the reason our tagline is your trusted source for public health information. We may not have the service, but we'll get you the information. We'll get you to who you need to be. That's really what we're charged with. We cannot possibly, for the 1.2 million people or so that we serve, we cannot possibly do everything for all those people, but we can partner with people that do. That's what we're charged with. So another thing we've done is we've created a speakers bureau, which will be rolled out this spring. And that's going to be about 61 or 62 different topics to start that you will have the option for free presentations, free in-services, free hands-on demos, depending on what it is. And I'll just give you one example. Matt's team does food protection. They are experts. They do thousands and thousands of food inspections. But for lay people, you know, the moms and pops, the grandmas and grandpas, whoever's cooking food for the family, they might not know a lot of that stuff. So whether it's a senior center, or it's the parents at a child care center, or it's kids that don't have home ec in school anymore. Home ec's being weeded out, we're seeing. But kids have to learn that because moms and dads are both working. Kid comes home and they have to kind of cook or prep or snack with their sibling. We want to show them how to do it safely. So we partner with area chefs. And they come in and we do a chef demo with a tasting, and the kids get to try stuff. We almost make it like Fear Factor. What do you mean you don't eat Brussels sprouts? We're going to show you how you're going to like it. What do you mean you don't eat beets? We're going to get them trying a food that they've never had before. And we're partnering in new and different ways. We partner with Mark's Grocery Stores. They donated this year over 4 million packets of seeds for us. So we partner in the spring with folks, and we get them growing gardens, and then later in the year we harvest what they grow, and we teach them how to safely prepare that food in a delicious, heart-healthy way. And I don't think many health departments are doing this type of engagement. In fact, I know they're not, because on the national level, we're being asked to come speak, to jump on teams, to fly to places, to do this kind of thing, because it's unique and it's individual. We want to bring public health to you in a way that you won't ever hesitate again in the future, that you'll see us so much that you'll say, yeah, we don't just see you doing inspections and checking out animal venues and tattoo parlors and sampling beaches. We know who you are. We're signing. This contract is no problem. We know about the services that we get. And you specifically asked some questions that I want to address, if it's okay, about spotted lanternflies, lead, and about bed bugs. So I brought some things with me. We have worked with the bed bug task force in the area while they were in cahoots, I guess, with us for years and years, and they've since waned because that progress has really gone a long way. We have less and less, wouldn't you say, Matt, less and less need? And so these are little gauges, they call them, and they go underneath the bed frame, the 4 posts of the bed, and it gives you all the directions on how to identify and eliminate bed bugs using these things. So I brought some information for you. We have more of these kits available. The Bed Bug Task Force gave them to us for free. We've got a cute little bag that it goes in. We can bring these to you. We could talk to residents. If you knew that it was a wide-scale problem, there's a bunch of apartments or a bunch of homes, we could have a meeting here at any time. We could bring an expert, Tom Barsa. He's an absolute expert with our vector control. So I'll leave this information for you. Matt certainly is an expert if you have any specific questions, but bed bugs identification is really key. People spot other things that aren't bed bugs and think they are, so we brought you some really simple identification cards so they can really see what the differences are. And we are happy anytime to jump on a call. I'm not sure if you know this, but 24/7, 365, we have an emergency phone available. Bed bugs aren't something that we would consider an emergency, but let me give you an example where we'd want you to call that number. You're out in your garage, you and the significant other, you're putting away the garden tools because you're sweeping up you're trying to rake up all the leaves, and somebody gets grazed by a bat and they drew blood. You don't know if it's a claw, a tooth, what it got you, but you're bleeding. And you saw the bat, but it flew away. Absolutely, positively, 216-201-2000. You call that number. We will order the prophylaxis. You have to have it. Rabies is not curable. If you contract rabies, you die. So because rabies regularly are tested positive, bats are positively tested for rabies in the state, we would want to act on it the same day. Same thing, you get mauled by a raccoon. You go into your garbage and you're pushing a bag down and a raccoon comes out and bites you. If you can't get that raccoon and kill it, which we don't expect you to be able to do that, but if for some reason you could, someone in your family's like, nope, I shot it, or the police officer shot it, we're going to go ahead and have the head tested. Don't shoot it in the head. We need to test the head. But let's just say you couldn't catch the animal. We would absolutely prophylax you. We would have to get a hold of you, and that we do that emergency-like. Another example of emergency, we had a case of a person presenting with Clostridium botulism at St. John's West Shore. And on emergency phone, I took that call, and we ordered the anti-vax from Atlanta, and the same night it came. It comes basically on a special plane just with that. It's really a crazy thing. The gentleman came to my vehicle. He met me on the tarmac at Cleveland Hopkins, and he commandeers your vehicle. He literally handcuffs the stuff to your wrist. You hold a little package, drive right to the hospital. They give the guy the shot. 20 minutes later, he wakes up. The person would die without it. Botulism is not curable unless you have anti-vax. It's these kind of things that we do behind the scenes. On a simple level, we just did a hand, foot, and mouth case, a communicable disease that happens in childcare all the time in your city. We are constantly acting on epidemiological cases. I have a whole list of them for the county for the year. They do not break it out by zip code because sometimes you can track it in a different zip code than where you live. So it's hard for diseases. We just do the whole county. But I'll leave that with you to see all the behind the scenes, whether it's botulism. I mean, we investigated an anthrax case. It didn't happen to be anthrax, thankfully. But you never know. Leprosy, we invested a leprosy case. You never know what kinds of weird, like biblical proportion things that we're doing behind the scenes. So that's the last service area I wanted to touch on, epidemiology, surveillance, and informatics. They're the folks that keep all the data regarding different types of illness. One such report that people don't even know that is world-class that we do, literally people all over the globe want to see it, want to read it, and want to mimic it, is our child fatality review. It basically examines all the reasons that children would die in our county. Although it's exhaustive, reading it, it's very sad. It is also very telling, and it helps us educate on the things that we can do prevention-wise, and we are working toward those things. You guys mentioned about the spotted lanternflies. I wish I had better news. They are an invasive species. The only good news is that they're kind of cool looking and they're not harmful. They're not a pest from the standpoint of disease. They can kill plants and trees, unfortunately, and they can kill other beautiful species like butterflies because their stickiness that they leave behind can trap some of those animals, those flying insects on the trees. But I brought information about them and what they look like in all their different stages and how you can prevent. It's sort of a checklist for residents on what they can do to negate them. It's nearly impossible. They do follow the railroad track line because they're hoppers. They hop from one thing, almost like a tick does. They don't fly very well, but they hop. So they came in from Asia, and they came in on railroads. So they are all along our B&O railroad line, unfortunately. And they're actually watching it from the eastern seaboard all the way out west now. They've already gone across the United States. But the only good news is they don't carry any kind of disease. They won't bite you. They're just icky, and they leave a sticky mess on your trees. So I left information about the things that you could do for them. And you also asked a question about lead, and one of our lead specialists gave me a great handout, and I'll leave this for you, but just to give you some statistics, we test the micrograms per deciliter of blood levels, and we do that two ways. We either do it with capillary testing, which isn't as exact, or venous testing. So we tested in 2024 about 120, or 115 rather, people, and we're looking for that 3.5 to 9.9 micrograms per deciliter. That's sort of the range that we're checking. Anybody over 10 micrograms would be considered positive for lead, and we would take action to remediate it, chelating their blood, giving them medication. And as far as lead remediation, the numbers are huge in your community. In the last 5 years, we're upwards of $450,000 toward home remediation. We addressed the lead hazards in 25 units during the same time period. 5 of those had lead hazard control orders. So as we get money for lead, and we know one of the main reasons that we are anticipating the shortage that we anticipate in our budget the next 2 years, which is the cause for us to do the 12% in 2026 and 2027, we've been told that both the state and federal level anticipate getting less monies trickling down to you. There's a large number of our grants that are questionable, lead being one of them. And that's scary. I'm not sure how familiar you are with NOACA or the maps that NOACA produces, but they give these what they call heat maps. And they show greater Cuyahoga County. And the same places that were redlined years ago, our underserved populations, are worse for every single thing, y'all. Whether it's smoking cessation problems, like can't quit smoking, or drinking problems, or lack of income, or lack of education, or lack of money in general, lack of health insurance, lead in homes, complaints about mosquitoes, and every single thing that it coincides, every single thing with redlining, because these are underserved, poor communities, and they have been for a long time. They don't have as healthy of food choices. They don't have safe places to exercise. They have higher crime rates and drug rates. The one silver lining, the one program that we can show you up one side and down the other that we are remediating is lead. And the reason is, unlike things like opioid addiction where it's cyclical and it repeats itself, once you've gotten rid of the lead, it's done forever. It's a success. It's a huge win. And our lead program is doing a fantastic job. And they've been doing a fantastic job since I've been there, which is 1998. I can't speak before. I think you were ahead of me by a year, Matt, so you could maybe speak a year more. Fantastic. And one of our recent retirees, our deputy director, John Sobleski, is a big reason. He has received millions and millions of dollars in grants that he's put directly into homes across the county for our least served people, and he's turning it around. So he retired, and we all sniffed a little when he left us because we love him, but he did a great job, and he left a great team, including Matt behind him, to follow in his steps. And I can tell you, lead has been a huge success. But in the meantime, while we're waiting for those dollars to come through, I brought for you some tips about preventing childhood lead exposure. Because in the meantime, while we're waiting to remediate the actual lead paint and the lead surfaces, we could be doing things to knock down that lead dust and keep kids safe. So these are the kinds of materials that for a sanitarian like myself, or for our legal expert, our legal counsel, it is no problem. Anytime, day or night, that you contact us, we will react. And if it's something that you're like, hey, I need this today because blah, 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 we've got somebody coming to Lakewood. We'll have them swing by and get it to you. We want that kind of reaction time. We know dollars are going to be tight from the feds and the state. We know that. But we know that you expect superior service. So between the Speakers Bureau, our improved brand new website, our increase in IT infrastructure, we have made a huge investment in our IT. We can get data to you much quicker. If you haven't visited our ccbh.net, please do so. You will be amazed at all the things you can look at, whether it's COVID or flu or any kind of communicable disease. We've got data up there. I mean, our trackers, our informaticians are amazing with some of the stuff that they do. So I'm going to leave you a bunch of literature. I'm definitely going to give you some of our new and improved lip balm because it is that season and we want to keep you fresh and kissable for the holidays. And of course, our agency brochure, which is brand new, literally today it was finished, which has just an overview of all the programs and services that I mentioned so quickly. I'm the youngest of 11. I'm the only girl, so you know I talk kind of quick. Sorry about that. Is there any questions that we can try to answer or any services that you can tell us this evening that you need us to respond to immediately?
And I hope to see you often in Lakewood,
We would love it.
educating the community about the services that you have to offer. I think that's going to become even more important as, you know, our medical situation, hospital situation is impacted. People are losing their insurance and Medicaid, and the underserved, as you mentioned, will really need more education. And when you talk about your vaccines that you give, how would someone know that they can go to the Board of Health to get them?
Excellent question. So you could call us at the 216-201-2041. That's the rollover clinic number. So no matter which clinic you're talking about, that main line, there's two gals, Lara and Dar. One of the two would answer the phone, and they would ask you what your zip code is to try to see what place is close. Because, for example, Lakewood, we're only open 2 days a month, whereas the Warrensville Heights open 2 days a week, and then ours in the main is open every day of the week. But let's say, for example, you needed vaccine and we didn't have it, or we weren't going to be near you, they will pull up, we have a map to find you vaccine in your area and give you CVS. Our job's to get you to whoever. Most vaccines are either insurance covered, free, or on a sliding scale. The worst case scenario is a sliding scale. Now, we have people that are affluent that can pay, and they do have to pay. Again, the poorest people not. But things like flu vaccine is always free. Because if your insurance doesn't cover it, it's picked up. No one is refused on ability to pay for a communicable disease. If they didn't have the money for something that's person to person. Now, unfortunately, rabies is not person to person. That's one that you have to pay for. So it's expensive. It's $600 and it's 5 shots. So that's not an easy lift, but unfortunately that one is not covered. But most everything we do, and we do tons and tons of screening under our HIV AIDS program. We do tons of screenings for free, testing for free, exams for free. You can get a preliminary breast exam and then be referred to mammography if you need it. What we're trying to do is be a stopgap for folks even before all the cuts that are going on now. Because there's so many people that are uninsured or underinsured.
It's true. And I do think you offer a great service, but my concern is I don't think people know about you. You might even consider putting some articles in the Lakewood Observer, which is the local paper that the residents can read and understand how you serve the community and where you are and how to access you. Because you can say, call the phone number, but if they don't even know you exist, they're not going to call a number.
I was remiss in not mentioning, Ms. Marks, that we do provide articles anytime. We're in about 15 newsletters every time they come out. We're happy to add yours to it.
Yeah.
We have a whole bunch of things on, whether it's vaccine and clinical, whether it's child care type, hand, foot, and mouth prevention, hand hygiene, everything from how to handle your septic tank to how to chlorinate your well to whatever. If you have questions and it's something even around different holidays, we're about to push out a bunch of things about Thanksgiving. Our website and our social media are blowing up. We have a whole social media team now that's communicating, and you're welcome to link to us and grab any of those articles because all the types of things we're using social. But so many folks really want us to come and talk to seniors or talk to kids we're happy to do that. But to your point, we know we're going to be making our biggest media purchase ever We just got a communication officer, I'm embarrassed to say, in 2011, and we've been open since 1919. There's a reason that there's an adage about public health that says we're the best story never told, and that's very unfortunate, but you're 100% right, and when we say better community engagement, better communication, we are doing that. We're going to be doing a major media buy. We're not sure with who. They'll have to go out to bid to get to take our business, but there's 2 or 3 main players, and we're going to be all over the radio and TV coming up in the next 2 years because we have to do it, to your point. And it can't just be people at tables, although we do that. We're happy to table at any event. We get lots of hits that way. But we know we need to do a better job advertising ourselves, and that's part of what this 12% will pay for.
And I think communication is important in everything, and there are always people out there saying, I didn't know, or how do you hear? So you just have to cover all bases. So I'll open questions to the other members of my committee. Does anyone have a question?
I do.
Yes. Councilwoman Striebeck.
Thank you. Thank you, Chair Marks. Just for a point of clarity, because I'm looking at the agenda for today, and it says that we're going to be entering an agreement with the District Advisory Council of Cuyahoga County, the Ohio General Health District. But I also hear Board of Health. Is that the nickname? That's the old name, and this is the new official name? Or tell me about how that goes.
Sure, that's it. Boy, good eye. We need you to scrutinize some of our literature that we put out. That is excellent that you even know. You're the first person, and there's 58 of these, so good for you. The District Advisory Council is the overseeing board that votes on our Board of Health members. They're even above the Board of Health and above the Health Commissioner. They are comprised of members, usually the mayor or trustee from townships and villages. Cities do not sit on the DAC, but they're our governing board, and they're who actually accept on our behalf any monies that are considered general revenue. They have to approve, and they did approve already for us to go out to say that we could even do this 12% increase. Between our board and the DAC, it was presented to them first. Once they approve it, then we come to each community and say, here's your contract that coincides. So good eye, but we're one and the same with them.
Thank you. I mean, I'm trying to figure out who to call, because sometimes you call the city.
Right.
Sometimes you call the Board of Health, and I wasn't sure if now we had a third party here that we were supposed to get a phone number for, so.
No, and before I leave, you'll have my card, so you'll have my actual cell. You
Very
can call
good.
or text me whenever.
Very good. You stated that we have 3 specific people that work in Lakewood. One does food, one does water, and one does
District.
in the district.
Your district person, her name is Stacy Coltis. We'll have them each come by and introduce and leave business cards with the mayor's office, but Stacy Coltis has been with us 30 years. Go ahead, I'm sorry, Matt.
Councilwoman, yeah, what the district person is, that's our term. They're a generalist. That person is typically your senior sanitarian. They've probably already spent many years in food and doing other things. Now they're doing schools and pools and handling your nuisance complaints, your animal bites.
Lead.
Sometimes lead. Sometimes we might send somebody else in here to do lead. That's because lead's very specific. But those folks are typically the ones that have been around for many years, usually more than 8, I would say, although we're getting very young. But that's what the district sanitarian is. They're typically the person that's handling everything but food. You don't see your water person in Lakewood very often because, frankly, there isn't a lot of sewage and water to deal with. So they're going to spend most of their time, in other areas. But the food person would be in City Hall more, because they're dealing with restaurants every day, so they're interacting with your building commissioner. I know Chris Sargent, our food sanitarian, talks to your building commissioner weekly about different issues. So those are the 3 main ones, and here in Lakewood you're going to see food and your generalist or your district.
Excellent. Thank you for that explanation.
Madam Chair,
Yep.
the address, I looked it up for you, for the immunization clinic in Lakewood, 12805 Detroit. So Suzanne was right. It's right down the road here. And we probably don't operate that every day. So you have to call, someone would have to call.
Twice a month.
Twice a month.
2 days a month, yeah. And as the need increases, as we advertise more, we will be here more.
And then I had a question about, and I'm excited for your new medical vehicle too. is it just education, or do you also do treatment out of that as well?
No actual treatment. We have a nurse practitioner. Her name is Kelly Stake. She is absolutely phenomenal. Wait until you meet her. We want her to come and speak. She does a lot of idea stream for us now and radio. We regularly are on the radio and on TV and doing all sorts of articles. With our increase in external affairs communication, we're doing a lot more of that. But Kelly is wonderful, plus a whole team of nurses. So they actually would test anonymously for STIs. We can't have a mobile medical unit that just does that. Who's walking onto a unit that says outside, hey, STIs, get tested? Nobody's walking, right? That would be very bad.
Right.
So they do a lot of education and training. They do breast cancer screening, and then they do the STI testing and every kind of immunization that you can think of.
And we have an excellent unit in our fire department that does outreach too, and I don't know if you're partnering with them or not on anything. That might be another
Sounds excellent.
good idea to reach out to our chief on that one.
Well, we used to partner with Gordy Polando a lot when Gordy was here. We did tons of preparedness training with him, and he was, you know, a chemical engineer basically background. He had a PhD, super great with anything. I mean, he always wore T-shirts that showed you explosives and things. I'm like, you're freaking me out, Gordy. But he was phenomenal. We did a lot with him, and I know during COVID, you guys helped us. We did COVID clinics here, and you guys were phenomenal, but I will reach back out to them.
Very good. And then I guess my last comment or in question, really more of a comment, is just thank you for all these things. I mean, it's just amazing the extent that you go to, and maybe a connection to the Lakewood Community Service Center might be the only other suggestion I might be able to offer. So thank you all for being here tonight to help us understand this.
Thank you. It's our pleasure, truly. So many of our cities, I can tell you that Lakewood is one, you do present a big problem to us, and it's more Matt's problem than mine, so I like it, I get to pass it. And that is when someone gets moved out of Lakewood, whether district, food, water, or anybody, they don't like it. Even when our nurses get transferred and go to a different, everybody loves this city. It's one of the cities they fight for. And it's funny to me, when you have a responsive building in fire department, you have 2 libraries, you have a lot of really cool things in Lakewood. Our people don't want to leave. They love the city. A lot of us live here. John lives here. A bunch of us live in Lakewood. I do not, but a bunch of people do live in Lakewood. So you should be very proud of who you are and what you do. And you've always partnered, even at your festivals, your big events. You know, when you were going to have all the mobile units down in the beer gardens and that whole thing, it could have been a nightmare. Other cities, it might have been. But you guys handle things so professionally. You make it easy for us. So we appreciate it. We're going to give you a bunch of information. We even, English as a second language is a huge push for us right now. We're really trying. Our website is available in Arabic, Spanish, and English. Every one of us on our work cell phone has Language Line now. Over 400 languages are transmitted real time with a live human interpreter. So whether we're helping someone in a clinic, we're talking on a disease investigation, or we're doing a food inspection, we can get that live human interpreter to help us to communicate better. We used to spend a lot of time yelling at folks because we'd get stressed and they get stressed, and then they're just standing there blinking, and you're realizing that I'm talking louder. They can hear me. They just don't understand me. What am I doing? So just to give you for instance, just in our lead book alone, it's available in Nepali, in English, in Spanish, and in Bhutanese. We're trying to meet people where they are. And lead is a huge problem across our county still. We're working on it. We're making successes. But I'll leave these just to give you a feel. And you certainly have all these populations in your community. So we want to meet people really where they're at. And this is just one program. And our food program has quite a few, 7 or 8 different languages for things. But we know we need to do more. And we're engaging more. And the last thing I want to leave you with, too, because we didn't touch on it, but when we talk about underserved, our homeless population is getting to be greater and greater, which is unfortunate. We are doing more work with Lift and Bridge Street Outreach. Those are serving underserved or homeless people every weekend. And we're stepping it up as an agency. A bunch of us are volunteering. It's not on the clock, but it's something that we care about. And I know you care about. I know Nature's Been did a lot of that work. Your Y does a lot of that work. So if you need us for that, if there's resources needed, we have a group of medical students from CASE who are going out with us and actually treating folks on the street. So we're trying to expand the services that we do in new and creative ways, even if we have to do it as volunteers on the weekend, because we care about people. We want to make sure they're healthy. Were there any other questions for us this evening?
Yes, Councilwoman.
Thank you, Chair Marks. So you talked about the so the question I have, you talked about the health outcomes and the plan that you have. What are the health outcomes specifically for Lakewood? Do you have those, and are you able to share what those are?
I love that question. Unfortunately, we have broken out as an entire
Okay.
county, and again, it's because sometimes where we meet the person is where they're employed, where they go to school.
Okay.
Not necessarily where they live, so it's not by zip code.
Okay.
But what we're working on, and we're going to ask for input from the communities before we roll it out for next year, is an actual report card by community.
That would be amazing.
Yeah, and the reason that it's really difficult is because the data is not stratified that way. A lot of the data comes into us bulk, and we didn't create it, we just house it. So it's a child fatality review is a prime example. We will know that a child drowned, but a lot of times we don't even, it's a Jane Doe, and we don't even know where that child is from. We don't have data on where they live. So it's Cuyahoga County, but it's just generalized. And I shouldn't say a lot of times, those are rare. Normally we know, but sometimes we don't. So a lot of the data that comes in on illness and injury, it isn't collected by our people, and unfortunately, we don't get every bit that we need. But we're working on a plan, and I know our friends in Strongsville, our friends in Cleveland Heights, our friends in Shaker have already asked us, when will the report cards be available? It probably, to be very honest, either late 2026 or early 2027, because we still have to merge about 7 different information systems. But we do have some very specific data on the entire county, which I'm leaving for you.
Okay.
And if you ever have want for something specific, you're like, hey, someone in my family got Campylobacter, someone got Shigella, someone got staph, I want to know, I can give you data countywide, and I can give you anecdotal information about like outbreaks we've investigated in your area. Because that's interesting to people when they're like, I got XYZ, I got Clostridium perfringens, we'll see a spike. Knock wood, we will not, but we will every Thanksgiving because people don't thaw their turkey properly. And they don't handle their raw stuffing properly, and then we have an outbreak. That's why we're doing a big campaign, radio, TV, social media, website, to try to push out information about this. But every year, the Monday and Tuesday after Thanksgiving, we see a spike. So if you wanted to know about clusters of illness as we found them, we would happily share that with you.
Okay. And then the other one, you talked about the community health needs assessment and then action plan, and I'm not sure if you're familiar that we, as a city, did a community health needs assessment, and we have a community health action team and created an action plan. So is the counties, that's countywide, correct?
It is.
And is that available on the website?
It will be. It's
Okay.
almost done. It's, an outside company is putting it together, and then they're going to vet it through us, and we're going to look it over and tighten
Okay.
it, because there's always some things that granularly we want to drill down our EPIs. But yes, it will always be available. Our strategic plan is on our website already. Our the year annual report, that's the
Okay.
words I'm looking for. Our annual report is already on our website, and then as soon as that's finished, it'll be up there.
Okay.
And if you would ever like us to sit with you and say, hey, John, Suzanne, Matt, this is what we're doing. Where can you fit in? How can you help us? We're doing that for 2 other communities already. We're doing that in Highland Heights. We're doing that in Maple Heights. We would be happy to try.
Yeah,
see where
I'm
our-
thinking that we can, we should definitely connect you, Chair Marks, we should definitely connect her with our chat team. And I think there would be some overlap there. And
sure.
also, as we're in the process of finalizing a racial equity plan, I think that there would be some great, perhaps information that can just be pulled from your action, your health, the needs assessment as well, as that's getting finalized.
We would be happy to. Our expert, I would say, we have 2, Nichelle Shaw and her upline, her director, Martha Halko, are phenomenal with all things CHA and all those different
Okay.
plans. And then, I'm not sure if you're aware, but we also have a director of equity, diversity, and inclusion, Dr. Andre Brown. And he has LaDon Monteleone, his employee, who's spent a lot of time in your city. They do
Okay.
a ton with LGBTQ community and just communities of color in general, communities, anybody who's underserved English as a second language. They're doing a lot about brain health, equity relative to dementia patients. I mean, tons. We do these brown bag lunches. We would love to connect you with both of those groups because they are real. I'm on the periphery taking notes, but they're the experts.
Yeah, no, I think that would be great, and that work is happening right now. We do have a consultant that is going through and working through that with our anti-racism task force, so I think that would be a great connection. So I can definitely follow up and connect you. And then my last, 2 more points, sorry. I see that Ian Andrews walked in, and so my question was, are you familiar with Lakewood Alive? And I'm assuming you work together, because I know you talked about bed bugs, and I know Mr. Andrews has dealt with that. They get a lot of calls, so I'm just wanting to make sure that those connections are made.
I know that your team sends stuff to us a lot. Yes, thank you. We do get a lot. We get a lot of calls and questions, and we have gotten complaints relative to bed bugs and different things. I have not worked with you guys yet, but I do know of you because when I used to volunteer at Nature's Bin, they bragged on you guys all the time, and I regularly work with the YMCA and the library, and they brag on you all the time. So my cards are here. I hope you will take one and reach out. As this position, I was in food protection for years and years and just wanting to do this kind of stuff, but now I get to do it for my full-time job. So I would love to connect more.
Okay, perfect. That's great. And then the last one is I do have an opportunity for you in the summers that would be great for you to come out at least once. It's Madison Court Community Coalition. It's a group that I was co-founded, and they do monthly block parties that start in, they typically start in May, depending upon the weather, but they may start in June. So June, July, August for sure. And it's in our Ward 4, which is our, has a lot of high needs in that area. So it would be a great connection point. And if that mobility van is available, I think coming out to one of the block parties, parking right there in the parking lot and being there to serve the community, I think would be great. So let's connect after, get your business card, and I'll follow up with some of those connections.
Thank you.
You're welcome.
The more the merrier. We've almost tripled this year. We're too shy. We're looking for 2 more before the end of the year, so I can say we've tripled the number of outreach from last year to this year with the creation of my position. And we're being very discerning. We're not just going for 10 people. You know what I'm saying? We're going to the places where people are in mass, whether it's in Cleveland or outside of Cleveland, because we know people are like, you shouldn't be working in Cleveland. They have their own health department. That's not true. Many of our folks from the outer 58 go to Cleveland. When it's a big event, they're going. There's thousands of people. So we want to be where you need us.
Yeah.
Okay?
Definitely.
Thank you so much. I have all the materials here. Did I miss anything, gentlemen?
I don't think so.
Mills? Oh, we're good?
You can see why she's our communications director. If you're not clear by now.
Well, thank you all for coming.
You're
So
welcome. Thanks for having us.
I'd like to move this forward to council for full approval. Yes. So I need a second.
You need a motion to move this favorably back to council.
Yes.
I will second that.
All in favor?
Aye.
Thank you. So if there's no more business, we can call the meeting to a close. Thank you, everybody. Thank you again very much.
Thank you, Ms. Marks. Thank you. Thank you, sir. Sure.
We'll get started in a minute with the Housing Plan and Development Committee meeting.
Nice to see you.
Yeah, I was like, I'm going to be parched.
I'm going to get this. I'm going to give this all to your sir. Thank you. Thanks for having us.
Hey, Councilman Bullock, can you hear us?
Let me give you my card. I'm going to leave it all.
We cannot hear you yet.
Hello, can you hear me?
Oh, great, we can hear you now.
I love your pictures.
I am here. I'll be on camera in a sec.
I prefer you to keep the picture, Tom.
I'm leaving it all.
It's like, how could I be at a static shop but still show action?
Here's the phone. It's my pleasure.
You good? Only a minute late. I'll go ahead and call to order the Housing Planning and Development Committee meeting for 11/10/2025, which is actually my anniversary. The first order of business is the approval of the October 27, 2025 meeting minutes. Is there a motion to approve? Second, all those in favor say aye. Aye.
Aye.
Tom also voted yes
Yeah,
virtually.
could you hear my vote?
Yeah, we can hear you. We're good.
Okay, good.
Just noting it for the record as well, in case it wasn't picked up on the recording. And then the next order of business is it's a communication from myself for a reminder to my colleagues. I'm the council appointee to be an ex officio member of the Lakewood Alive Board of Directors. And I often like to bring back updates about the organization, although I know many of us on council already kind of know what Lakewood Alive is doing. But sometimes we know based upon some of the fun events they put on, Summer Meltdown, Light Up Lakewood, but their work is much deeper than that. And I always love to go to the board meetings and hear about the good work that they're doing. And Ian Andrews suggested that it might be nice to bring them before council to elevate their work, not only to us as a body, but also to the community that may be watching, and also for posterity. So at this point, I will throw it over to Executive Director Ian Andrews and Assistant Baseball Coach on the 9U Lakewood Rangers baseball team.
Thank you, Chair Baker. I appreciate it. Thank you, members of council, for having us tonight. I'm joined by my colleague, Joe Higgins. Joe is our operations manager. Joe runs point on all of our special events. She's heading up all of our small business support efforts, as well as a significant number of, as her position would indicate, a lot of our internal operations. So I appreciate Joe joining me tonight. Thanks for having the opportunity. We're going to dive right in. So I appreciate giving the chance to have an update. We appreciate you, Councilman Baker. If you wouldn't mind, next slide, please. So we all know the the mission and vision. Really, just very quick, we want to ensure foster and stay vibrant and welcoming neighborhood, but 3 core pillars. We're going to talk about the first 2 tonight: housing outreach, thriving commercial corridors. Within that thriving commercial corridors, that's where our small business support program resides. Next slide, please. Next slide, please. Thank you. So
Ian, I may suggest you may be able to grab that.
We don't want to mess up Tom.
Oh, if Tom, oh, got it.
I don't want to screw it up.
Of course, Tom.
Right. That's okay. Right. All right. So again, really quick, because then we'll get into some stats and some stories, but I just want to give the overview, kind of lay the land. So the housing outreach program started in 2009. Originally, the organization was a Main Street economic development organization. Housing is economic development in Lakewood. We got to make sure that we're stabilizing where people live. Without sound, stable housing, the whole thing falls apart. So the mission is to ensure that all residents are living in healthy and safe housing. We have several staff dedicated, as well as shared time by myself and other folks on the team. Continue, please. This is the kind of a laundry list of all of the sub-programs within the housing outreach program. I thought it was important to show Paint Lakewood, exterior-led remediation for low-mod residents, CDBG funded, our bedbug program, which thank you, Councilman Steiner, for alluding to. That's a pretty serious one where we are the city's agent on bedbugs. So if someone suspects they have a case of bedbugs and they call the city says, call Lakewood Alive. We have a certified inspector. He's gone through a certification to be able to go out, assess, determine if there is an infestation. If there is, then we're going to work to try to figure out a remediation plan. We are not going to remediate, but we'll try to work in figuring that out. Pretty gross, pretty serious. Project Safe Senior, aging in place assessments. This is really crucial stuff. We'll talk more about this as well. So years ago, about 40% of our clientele were seniors. Without even trying, that's now become over 70% of the folks we serve. As a county, our population's aging. We all know that. It's no different here in Lakewood. On top of that, you've got folks who are living in houses where 80% of our housing stock's 90 years or older. So how do they navigate their home and stay safely? On top of that, we have such a lack of senior affordable housing, there's nowhere for them to go. So how can we help them stay in their home as long as they can? Because quite frankly, there's nowhere else for them to go, and try to make sure that they can be there as safe as possible. So we'll talk more about that in a little bit. Knowing our home education, let's teach people how to take care of their houses. There's still a lot of stuff. I have no idea what I'm doing. So knowing our home is really helpful. The toolbox up at the screw factory in a big 40-foot shipping container, that's a really great program, but it's also teaching people how to take care of their homes. And it's just a really fun program for the community. Hoarding assistance, you're going to see some more photos on hoarding. This is really getting out of hand. We have so many issues in town where people, hoarding is a mental health disease. It's an issue, and that mental health piece isn't being addressed. But the results of it are what we see, or sometimes it's behind closed doors, and you open it up and the fire department walks in and they can't get through because it's everywhere. We'll talk more about that. Thank you. Go ahead. And partnerships. So much what we do is through partnerships. We are not going to stand here and say that we can do, should do, will do everything that there is. We've got a lot of partners, not only in Lakewood, but throughout the county, but primarily City of Lakewood. We work with every single department for everything we do, and we could not ask for a better partnership with the city. Next slide, please. Here, that's fine. Actually, you can go back one. I'm sorry. Real quick story, because I always have stories. This, the photos on here, this is a hoarding house where there was a woman over, I believe, on Broccoli, and she was in the hospital, and her neighbors said, we have a serious problem here now. You're going to see a lot worse later on. This really isn't even that bad. But you've got Mark down there with a garbage truck and a couple of our Lantern volunteers. It's a sober living house. We went in, and there was just cat feces all over the house. Her neighbors were so worried about her, and so they were able to get us in. She gave us permission. We were able to discard a lot of the things that were really creating a pretty serious health hazard for her, try to get her back into the home because she had nowhere else to go. Next slide, please. Here, this is a picture of our 18 volunteers. These guys are amazing. A lot of you have met them. There's Carl Orban. Aaron's right there. These are skilled volunteers. Most folks we have who go out are unskilled like myself. We'll do landscaping. You can rake leaves.
Give yourself some credit. Come on.
Yeah. These guys, rebuilding porches, pulling permits. This year we did 4 different garage repairs. So instead of putting them on one house, we're going to talk about garages. They went out, they were able to save 4 different garages from collapsing and to stabilize them and get them back into good repair and into code compliance. Next slide, please. And then again, partnerships. This house right here, this is Mrs. M. I'm not supposed to say the name. Mrs. M. She lives in Ward 2, southern part of town, and she is in her mid-90s. She's an immigrant. She immigrated here in her late teens. Her husband died the day before their 60th wedding anniversary. What we found was that she'd been cited by the city for the condition of her porch, for the paint. Even though it's aluminum siding, it still was in really poor condition. Once we got in, realized her electrical panel needed replaced, her furnace and hot water tank also needed replaced. And she said, I just want to sit on my porch and just have lemonade. That's all I want to do. And I can't do it safely because it's gonna collapse. We were able to work with the Division of Community Development. Marty Castellani is fantastic to work with. We worked with Marty and Dan Wyman in the city to be able to get the funding to be able to repair the electrical panel. You see it right there. New furnace, hot water tank, repair the porch, actually rebuild the porch. And then with volunteers, there's Mike Bentley's team in the middle, down in the bottom shot. There's Cox Communication on the lower right. They all came out and we were able to prep the house, prime it, paint it, and she is now completely in code compliance. And there's a picture there on that bottom left. We were able to have a lemonade on her front porch. Next slide, please. Again, following partnerships, all the different organizations here in the city. Next slide, please. Let's pause real quick. So just to describe the photos you see, the one in the upper right is Eldred. This was a significant hoarding issue. In the interior of the house, they had bed bugs. Backyard was a mess. Front yard was a mess. That's the rubbish pile in the front. This was a board staff project. The second from the right is our snow shoveling program, where we go out and we have volunteers who are shoveling for seniors because they just can't do it themselves. The toolbox there in the next one, and then a volunteer project far left. Next slide, please. So here's some stats for you. Now we're going to do this in 2 different ways. This is based on what we reported for CDBG to CAC. When you hear what we're doing with small business, that's going to be calendar year. But here we've got 417 households served, non-duplicated. That means that's one interaction. You guys know as well as I do, every single one of these people requires multiple interactions, and the further this stuff goes, the deeper it gets and the more time we're investing. 88% of that 417 are low mod, 60% are female, and 72% are elderly. So this tells you right here, we have a significant number of low mod, elderly women living in houses that are 80 or 90 years or older. Next slide, please. Here's aging in place. In FY25, we performed 27 full aging in place assessments, and what we're doing, we're going into these homes. Mark and Matt are both aging in place certified. We're also tag teaming with Oliver from the neighborhood paramedic, who is a fantastic partner. And so we can go in and assess the condition of the home and how they navigate their house. Oliver assesses the condition of the resident, the person who's living there. And combined, we can kind of come up with a plan, make sure they're doing okay and they're safe. You'll see on the far right there, this is our favorite tool. It's called a standard bar. And I bring it up not to be silly. It's such a small device, $70. Spring-loaded, vertical. It goes to the ceiling, goes to the floor, or onto the ledge of your tub. You get it tight, and that bar right there swivels. You put your hand on it, and you can, step away from the mic, step over the tub. That's it. But that simple thing might help someone from falling and breaking a hip, and they're never coming home again. So we're putting in standard bars all over the place because it's something that we recommend everyone always do, along with grab bars and many other things. And we've been able to receive some private grant funding to be able to install some of these things. So instead of just saying, here's a list of improvements, we're actually saying, here's the list, and we're going to help you install some of that list. Next slide, please. Again, back to Division of Community Development. This past year, working with the team in the Planning and Development Department, 12 different projects resulted in over almost $240,000 in improvements. That story, Mrs. M, the porch, electrical panel, hot water tank, furnace, that came right out of that. To be able to have the 0% deferred loan, the 3%, the ramp grant, weatherization, we are using all of those programs to be able to, in some large scale, some small, but regardless, they're all important to the residents. To be able to leverage those funds, what we're doing is we're going out, we're meeting with the client, we're assessing, we're seeing what the need is, and then we're coming back to our partners at the city. And every Wednesday, we have a meeting in our office, and we're evaluating and talking about what we've seen. And from there, we can come up with a plan to see what we, Royal We, can fund, but we're walking that client through the process. We're going out, we're getting 3 bids on every one of these jobs. So Mrs. M, 4 jobs, that was 12 different contractors we had to reach out to because that's what you have to do. The client's not going to do that. They're intimidated. They don't know what to do or what to say. So we're doing that. We're helping them to fill out the paperwork and get to yes with our partners at the city. Next slide, please. Paint Lakewood, federally funded CDBG. We really have unlocked something exciting this past year. This has been around for a long time, but you all know it. The cost of painting your house is exorbitant. So you have low-income seniors living on fixed incomes who are cited. They're going to get hauled into court, pay court fees with money they don't have, but it still doesn't remediate the problem. And so to be able to increase the amount of money that we can provide to residents on a sliding scale of 30%, 50%, 80% AMI, that has been something that's allowed us to get more paint jobs done this past year, and we're really excited. We had a carry forward. We burned through most of that carry forward. So the request was made to increase the allocation from CAC for Paint Lakewood, and we're hopeful that'll happen. Next slide, please. Bed bugs. Here you can see some of the stats. It's not an epidemic, but it is serious, and it's pretty terrible. The way that we got involved in this very brief story was a resident of ours in Birdtown. They, I believe, if I remember correctly, because it's been a long time now, it's over 10 years, they were covered in bites. They didn't understand what the problem was. Well, long story short, there were bed bugs in their home, and they just had no idea. And they'd also just kind of gotten used to it. So we go in, we do our darndest to work with the landlord. It does typically tend to be apartments, but bed bugs don't know poverty. All economic strata. So I think we have to be really clear about that. Let's not just shame people. All economic strata. And so if we can work with the landlords to help to remediate with the legislation that we worked with the city and city council to pass and approve, that's where we have some teeth where we can hold these people and their feet to the fire. Next slide, please. Volunteer projects. We're a staff of 8. We're a small team. We're bigger than we used to be, but we're still a small team. We're working citywide. We've got 17,000 residential units, 13,000 homes, and over 1,000 businesses. We need volunteers. So here's some pictures of some volunteer projects. Upper left, that's Cox out at Mrs. M's house. Here's the A-team. There's Mike Bentley again. We've got a group of H2O kids. Joe works with H2O all summer in coordinating projects. And then bottom right, that's leaf raking. That actually represents 2 days ago a photo that I took. We were out on a house on Delaware. That's our 9U team right there, our head coach, Brett. But to be able to go out and work with that woman, Mrs. J, who we've known forever on Delaware, she's all by herself. So we're out there trying to help her out. Next slide, please. Challenges. Next slide. Garages. So I just said we've got 13,000 1- and 2-family homes. All those houses have garages. They were all built at the same time. They were not meant to last 90 years, but they're falling apart. The other part of the problem is there isn't any funding available, at least federally. There isn't any funding that allows you to remediate, repair, or demo and replace a garage. So old garages, same as the house, no money available. You're cited, what are you going to do? And then number 3, look at that cost. If you got to tear down $30,000 to $50,000 to tear down new pad, new garage, and these photos, these are not just pulled from the internet. These are our clients. This is right here in Lakewood. Between May of 24 and May of 25, over 100 garages were cited. So what are we as a community going to do? How can we, especially with our low-income seniors, but anybody, how are we going to be able to work with folks to repair their garages? It's a really big issue. We don't know what the answer is. Next slide, please.
And not to interrupt you, but
Please.
that has come up in the zoning planning advisory council, that, hey, should we have this requirement? So that's a ripe topic that when that hits us back for, when we change the zoning, whether or not we should, what's the benefit of that? And and what's the downside? And then, what should we determine as what our policy should be? So
that's right. And thank you for mentioning that. I was going to say that it also is really challenging with the, whether it's legislation or an internal rule that folks must rebuild their garages within 6 months. I mean, who of us could swing that? Who's going to be able to do that? So there's got to be a way that we can be able to try to balance the needs of the neighborhood, the needs of our community, but also the needs of these folks. And if there are variances or whatever it might be, I'd love to be able to be a part of that conversation because we're seeing it a lot. This is the same thing, driveways. There actually is someone who's cited for driveway and garage. So it's like a double whammy. What do you do? Same thing, $10,000 to $20,000 per driveway. There isn't any funding available for it. So we don't know how to repair this, how to take care of this problem. But they're still going to be cited, and there's still going to be prosecutor hearings, which we attend. We've got one tomorrow. There's almost 70 cases on the docket again. There's a ton of cases. And we'll go to housing court. We'll try to stick up for these folks. We don't know what the answer is. Next slide. Hoarding. Much like the garages, these are real pictures. These are our clients in Lakewood. Upper left is a gentleman on Madison. It's all mental health. He wouldn't dispose of those bottles, and that's what he urinates in. You can see the outdoor hoarding on the right, bottom left. The bottom on the left, second from the left, you can't really see it here. There's a dog bowl on the ground or on the floor in her kitchen. Far left, that's all feces. Second left is a dog bowl full of dog food. When I saw that photo, I asked my colleague, I said, does she have a dog? He said she did, died 2 years ago. There's still food in that dog bowl. We've got some really serious problems happening here in town. And so we have amazing things to celebrate. We got to make sure that we aren't losing sight of this, where we are failing, we, not Lakewood, as a community, Cuyahoga County, mental health. It's not being addressed when it comes to this issue. There are organizations in town who are trying to. They're not doing it. And so we need to be able to do better. Next slide. Beds for seniors. This is a challenge, but we actually have started to uncrack this a little bit. So this is kind of a challenge with a little bit of a success. We've got folks, and you have heard me say this, they don't have a bed to sleep on. The dignity of a bed. The dignity of a bed. A lot of folks, I think, make the assumption that later in life, of course, you have a bed. Well, these folks don't. For whatever reason, that's not for me to judge. But you can see down there on the bottom. Look at that, the chair. They're sleeping on that chair. The chair is disgusting. Bottom middle, that's from bed bugs. So that's got to go. But they can't afford to replace it. What we've done is we've been able to go out and raise some private money from foundations, individuals, and anonymous donor to cobble this money together. And for less than $500 a pop, we can get a senior a bed, frame, mattress, comforter, sheets, 2 pillows. Nothing fancy, just a place to put your head at night instead of sleeping on a chair or the floor or an air mattress that keeps deflating. We should be able to do better by our seniors. Next slide, please. I'll pause there. That's a lot. And then we can talk small business.
Any questions or comments? No. Yeah, Councilperson Hamilton Steiner.
You're right, that is heavy. And I think anyone watching this playback that is okay with any of this is, I don't know how to respond to that. This isn't okay, and we have to figure out a way to do better. We have to support our seniors. We have to do more to support you all that are there at the ground floor. That is like in the thick of it, in the weeds of it all. So I don't know what the answer is, but I know we have to do something. We have to figure it out. We have to work together. You're correct. The mental health is a problem, and I know the county, in their most recent budget, essentially eliminated all of that, which is not okay. So we, as a community, have to figure it out. We are not going to be able to rely on the state. We're not going to be able to rely on the federal government. So we're on our own. We have to build our community. We have to take care of our community, and we have to take care of each other. And we need to be taking care of our seniors because this is not okay.
Thank you.
Councilperson Marks?
Thanks. Well, Ian, you know that I have always been a strong supporter of Lakewood Alive. You all do so much to help the community in ways that, I mean, you see what we don't see, and you have to get up and go to work every day and see it again. I appreciate very much what you do, and I'm a very strong supporter of Lakewood Alive, and anything that I can do to make a difference, I hope you can reach out to me. All of your team, they're phenomenal. And, you know, you expose kind of the underbelly of the community that we don't see, and they may be living right next door to us. So I appreciate so much what you and your team do. And I agree with Councilwoman Hamilton Steiner. We've got to do more. We've got to do better to support you and to support the community, because the senior population is just aging more quickly, and these issues are going to become more prevalent. And it's embarrassing as a community that this is going on in our community. But I think of all the communities who don't have Lakewood Alive, who don't even know what's going on in their own neighborhood. At least we have you to expose this so we can do something, and hopefully we can make a difference. But thank you so much for doing what you do. I don't know what we would do without you, so I appreciate you very much.
Thank you.
Yeah, and or Councilperson Strebeck.
Yeah, thank you. It's, when you look at these last three challenges, the garages and the driveway, that seems financial to me. But when you start to talk about the hoarding piece and it becomes a mental health issue, that's a whole different thing.
It is.
And I wonder, and maybe Director Vargo, you can shed some light on this if you have any information as to people being cited for hoarding, you know, as a start, you know, because, right, I mean, somebody's got a stack of bottles and you're going to come in and say, you got to get rid of those bottles, and they say no. There's nothing much you can do. But if we can have a police officer come in with a mental health expert come in and say, you're going to be cited for this because this is not in your best interest. Can you shed any light on that?
Thank you, Councilperson. The limited information that I have is the difficulty with hoarding, as I hear anecdotally from the police chief, is the city, the housing, or the housing inspection crew and police need reason to go inside to see. We don't have the right to see that. There has to be some other purpose for us to get in, either permission from the owner or report of a crime, etc. So much hoarding goes on that the city is unaware of. And then when there's a disaster or an injury or a death of that person, that's when the city gets access and recognizes what difficulty that person was undergoing. Very challenging. Our police get, I mean, their hearts are broken. They get so frustrated with it. Very difficult issue. And you're right, it's unlike the external forces. We have plenty of eyewitnesses in the city of items on the house that are problems and garages that are brought to our attention, and our building inspectors can see that. Totally different animal with hoarding that exacerbates the problem.
Yeah, and just speaking from experience, and I think this goes back to the earlier points that all my colleagues have made, which is that during the Great Recession, shrinking municipal budgets, I think a lot of communities cut things like their departments of health, right? They went to the county board of health. They cut a lot of the community resources that we have with Director Barry, and Lakewood made a conscious decision to try to do their best to maintain that. And so I think a lot of what you're in, and I've dealt with some Ward 1 hoarding issues, and really it's a combination, and this speaks to the blended. I see Lakewood Alive as a force multiplier for what our great people in the housing planning, Director Barry's work, the fire department, with the neighborhood paramedic, force multiplier in a way that a small nonprofit can get into doors that government can't, right? For all the reasons that Director Vargo stated. And so in the instance that we had a hoarding issue in Ward 1, it was, and then the building department, once they get in there, they can only cite, it's like, well, can you get to the bathroom? Can you get to the sink? Can you get to the stove? Is the furnace clear so that there's not a fire hazard? So as long as the stuff is not in those areas, and you can't really cite because it's not a health safety issue, as I understand it. And so that creates this weird thing where it's like, well, Lakewood Alive can help. They're not the government, so they could get in maybe and connect with resources. And then some of the folks that we have, in our human, and community relations department can like connect with resources if they feel uncomfortable going to the government. Then you get the neighborhood paramedic in there, and they can do fall prevention, and they can do audits. So it's like, it's one of those things where a lot of, and this is just because I get to go to all their meetings and I work with the city, is it's a lot of the stuff that we already do, but it's harder for us to do. So Lakewood Alive is a great force multiplier for every dollar we spend to spend more out in the community and get more bang for our buck. And so, because I think that without the neighborhood paramedic, Lakewood Alive couldn't do as much as they do. Without some of Director Barry's work in his department, they couldn't do everything they do. So, and then same thing on our side, we couldn't do as much without them. So it's a very, every one of these kind of programs he showed you is in some ways already connected with and doing the work of the city with the city to make it better. So I don't know if Councilman Bullock has any comments moving forward. No? Okay. Well, you took a pause, so Councilman Evans.
Okay, great. And before, Danielle, would you mind just pulling up that map that I sent you? Because then I do want to get into small business support. This is Lakewood's census tract map provided by Dan Wyman, showing August 1, 2024. All of the shaded blue, these are all low mod census tracts. So I think there's an assumption that there's very little poverty, or that we don't have concentrations of poverty. And it's not to say that an entire census tract is falling apart. There could be one or two significant buildings that is low mod. It's not a bad thing that it's low mod. Senior affordable housing. That in and of itself could change that census tract to appear to be low to moderate income. But I think it's really important that we see this, that it's not just East End. Of course, sure, there's a majority on the East End, but it's throughout our community. So I think we just need to keep that in mind, that we have a wonderful community. We're doing some terrific things here. It's not necessarily all rainbows and kittens, but there are some real challenges that we have to face. And so I just wanted to make sure that you had this in front of you. Danielle, if you wouldn't mind going to the small business, please. Thank you. So our small business support program, this is housed within our Thriving Commercial Corridors strategic goal from our strategic plan. Born out of the Main Street program, there's me, just ignore me, but with Despina. She's an amazing woman from Greece, an immigrant here. Her husband's a school teacher. She lives real close to her shop. She opened during COVID. I remember hosting our citywide Zoom calls, and she wasn't even open, but she was cooking in the, whenever you like, Councilman Baker. She was cooking inside her shop while we were on the calls because she was still catering. Anyways, wanted to show her. And of course, Joe, our colleague Sarah, and myself, but we don't have anyone who is 100% dedicated to this program. The three of us share it, but Joe's running point, I'm assisting, and then Sarah works on our available properties. Next slide, please. Next slide. Do you want to go to Tom, or do you want me to keep going? It's up to you.
Yeah, did Tom ask to make a comment? Yeah, Tom, you can go ahead.
Go ahead.
You all right, Tom? We can't hear you if you're talking. Unmute yourself. I feel like we're in 2020 again.
Can you hear me?
Yes.
Thanks. Sorry, there's a lag or something. First, I'm sorry not to be there in person. I'm sick. But second, I think other council members have done a fine job of summarizing a a lot of what I would say. So I'll just say I agree. And Ian and Joe and your team, thanks for the very hard and skilled work you do. Really to, if Lakewood's going to be a diverse town with socioeconomic diversity, that means, especially today, helping maintain affordability is something we got to prioritize. And the city has a role, but a nonprofit CDC counterpart has also a very big role, because you can do things we can't because we're an umpire, a code enforcer, et cetera. And you can do things like help the client call the contractor. That's a great specific, right? So it turns out it's a lot of work to call them, screen them, find a good one, not get delayed or conned. So that's very helpful and significant. And so that's a small but good concrete example of your services. So I appreciate all you do, and I'll continue to support you. Thanks.
Thank you, Councilman Bullock. We appreciate you. Next slide, please. I'm only going fast because I want to make sure I'm mindful of your time. Okay, so much like housing, I laid out all the programs. I'm not going to read all this to you, but really some of the main key ones that we're focusing on. We are the fiscal sponsor for 4 different small business merchant associations. We'll talk about that here pretty soon, while also providing technical assistance, hosting the citywide. Our partnership with Planning and Development, working with Director Byington and her team, Amanda Kramer, absolutely terrific. Joe is on the horn with Amanda every day about a new business, someone else we're working with. How can we help them get a sign? This sign grant, it might be small dollars in the big scheme of things, but if we're hitting singles and doubles, I'm happy, because to get 50% back to a small business owner, up to $2,500 for a sign, that's a big deal. And if you're a business owner, you got to have a sign. So to have a program like that here in Lakewood, I think is fantastic. It doesn't have to be about home runs. Let's get those singles and doubles. Available commercial properties with City of Lakewood. You'll see that here in a moment. Startup evaluation. We're hearing from businesses all the time. I want to move to Lakewood. I want to open my business. And so we'll talk to them and find out, do you have a viable plan? Do you have an idea? Is this a hobby? And so, because we really don't want you, you're going to go rent a space, but you have no idea what you're doing. Let's maybe pump the brakes and talk about that before you lose your whole life savings and get it over your head. How can we be supportive? And then connect them to specific services. So working with the city on permitting and grants, and Joe's doing this all the time. Lease review, we have a fantastic collaboration with the Cleveland Legal Collaborative and Legal Aid. They'll review small business owners. They reviewed a business owner up on Madison. I think it was for $25, because she doesn't know what she doesn't know. She's good at her craft, but she doesn't know how to read a lease. And honestly, some people get hosed. And so let's try to prevent that from happening and be there to support them. And just knowing we're there to help, that gives her a lot of confidence in being here in Lakewood. Business planning support, we have a really great burgeoning relationship with the Hispanic Business Alliance down at West 25th and Clark in Central Via 25. Randy is a great partner. We've already connected with 2 different businesses. I just checked in with the one tonight before I came here to see how their call went. I'm waiting to hear back, because she's getting crushed by tariffs right now. And then another person in town. So to be able to have those resources and to be able to trust, to hand off someone. We build that trust, housing and small business. And when you hand them off to that referral, that other organization, and they drop the ball, that's bad for us. It's bad for everybody. We've got a good thing going with these guys. ECDI, Women's Business Center. And then again, a lot of the really, the Flower Blossoms program, public art installations, these things are nice to have, but they're also really important. They're part of the whole mix of making our commercial corridors vibrant. And then Mulching City Center, historic preservation, which I'm excited about some of our efforts on that front as well. Next slide, please. We'll talk about just a few specific ones. I forget what's next, I'm sorry. Thank you. So these are the small business associations. When we say fiscal sponsor, I don't mean to talk down, but just simply briefly explain it. It means that we are their bookkeeper. We are a 501c3. They are just a group of people who meet. And in the eyes of the state of Ohio, that's all they are. So if they take in money and they spend money under their name, which is not registered, they don't have an EIN, they have nothing, that's illegal. We're already registered. We've got it all taken care of. We can serve that purpose. And it's a great way for us to support those groups, to help them bring in dues, bring in the money, and then be able to spend the money to reinvest in their neighborhoods. So we're their bookkeeper. Next slide, please. Small business support, I mentioned the sign grants. This is it's such a great program. It is such a great program. There are so many cities that are not doing this, so I think we should really applaud ourselves as a community that we have this. Collaborating with P&D, as I said, Joe, working with Amanda on 17 different businesses for this calendar year. 6 of them have gone through soup to nuts, approved, sign up. Funktini Land in the doghouse, that was actually last year. Spellbound was also last year, and then the other one, Blue Health, over by near Beck Center. So $5,500 in grants, that's 50%. So $10,000, almost $11,000 invested in signs. I know it's only $11,000, but this money to these folks, that's a big deal, and it really matters. So I really love this program. Next slide, please. Available commercial properties page. Years ago, when we saw that other communities around town, or Beechwood or wherever it was, they were eating our lunch because they had everything online, and they would call us or the city or the chamber and say, hey, I need 1,000 square feet, $750 a month, restaurant. What do you got? And we would say, drive up and down Madison, back of the envelope, good luck. That's not good. Fast forward to today, working with our GIS friend here at City Hall, we are able to go in and we track all the available properties in town that we are aware of. Now, we can't guarantee 100% accuracy, but folks can find things on the internet. But because we're boots in the ground, we're driving around town. We're seeing it. We're seeing the sign they got from Lakewood Hardware that they wrote in Sharpie, call Uncle Bob at this number because he's got this space he's owned for 80 years. We know about Uncle Bob. Internet doesn't. We're going to get that on there. We're going to try to get that space leased. So it's a really good marrying of being able to be boots in the ground, proactive, being able to support the landlords because they're also business owners, and to be able to help recruit, retain, and get people in. One really great case that Joe worked on specifically over at Flame and Fable over by St. Ed's. She moved in, worked really closely with her on her sign package, on her getting her started, making sure she was running through the correct process at City Hall, making sure that she was doing right by the rules because she's an event-heavy kind of an organization. Fast forward, she is killing it. She's out of room. So, space at Elmwood and Detroit, our colleague Sarah, she saw a sign, made a couple of phone calls, tracked down the landlord, kind of said, who is this? And we were able to make the connections. Fast forward, she moves into that space. So we're going to help her grow. And then we're going to help backfill that space and work with Bert.
She just opened up, didn't she?
She did.
That's amazing.
Joe did all that. Yeah.
Joe, you're rocking.
Next slide, please. Small business partnerships, much like housing, same thing. I've already talked about the city, our partners over at the Lakewood Chamber of Commerce, Legal Collaborative, you can see it all here. We've got to have partnerships. And so part of what we're doing is saying there's so many great things happening here, there's good organizations, but there's also a lot in Cleveland and Cuyahoga County. Let's bring them to Lakewood. Next slide, please. This is kind of an overview shot because I really wanted to make sure that we include, that's Derek Brennan, bottom left, or on the left-hand side. That's phase 1 of Warren Road. The point, though, is public art. How can we partner with the city? This was also a CDSG grant that we got back in 2016, 2017 with Dale Miller to be able to leverage those funds and do a mini streetscape on Warren Road and then work all the way up to 90 in 3 different phases was a big deal. A volunteer project there, City Center Park. That was with First Federal Lakewood. If you squint, you can see some people in some green T-shirts. You can see on the bottom right there, this is a cleanup with King's Church that we had earlier in the year. That's over at Westwood, or close to Westwood, over by the CVS actually, and Detroit. We already talked about Despina. And then wrapping the signal box, that was a pilot. We can't get the utilities. They say, stay away from our stuff. Brian and I, we've been barking up that tree since 2014. And so we said, hey, City of Lakewood, we've got this grant money. Can we possibly wrap these signal boxes? Because you own them and you have site control. And he said, yeah, that was great. And so we gave that a shot. That's being installed during COVID. That was in the fall of 2020. And now the program that the city launched is phenomenal. I think it is the coolest public art installation around town. And I'm really glad that we were able to do that originally on the box. Next slide, please. Last one story. That's Patrick. He is the owner of Lakewood Black Label, Lakewood resident. He had his business here. It was too big. He had to go somewhere else. He was working in Cleveland. But he said, I really want to own my business or have my business in the city that I live and that I work, that I do everything in. But I've got a really weird niche. Joe, how can you help me? And so we pointed in the available properties page. We had the Norton Industries. You can see there in the middle over 117th, just south of the railroad tracks, had it listed. And we talked to the leasing agent a couple times, got her connected. Fast forward, 4th of July, he ran up to me. And I think you guys knew this, but I didn't know it. He ran up to me, he's like, oh my God, big hug. It's like, I found the space. And I found it because of that available properties page. And now, fast forward, he's killing it. And he's got more business from Lakewood-based organizations here in town, including baseball. They're sending out all the propaganda for us to buy baseball stuff. He lives here.
My kid has that Let's Taco About Hayes shirt.
The Taco Hayes, right? So you got this Lakewood guy who he's doubled down, and he's hiring people, and. Next slide, please. Lastly, partnerships. Again, I talked about this. Oh, I'm sorry, this shouldn't say partnerships. My apologies. Small business challenges. That's what it should say. The first one, Director Byington has heard me say this ad nauseum. Commercial property owners who are derelict on their property, they leave them vacant, or they're being used as warehouse. They're not zoned to be a warehouse. Let's go after them for that. Let's hold them accountable, because people say, oh, you've got all these vacancies and no one's moving. No. People are knocking down the door to be in this community. Sometimes some of the property owners are not willing to answer that call. Or you have someone who I reached out who has a phenomenal business, called the gentleman, he said, no, I don't want to lease it because I just want that parking next door. I'm just going to keep it empty for now. What are we doing? So how do we work to figure out a way to motivate those folks, understanding it's a private market? Emergency funding for disaster and unforeseen circumstances. First Energy. Our business owners are losing power, just like the rest of us. How can we, Lakewood Alive, City of Lakewood, our partners, potentially we have an ongoing dialogue right now. How can we set up an emergency fund for these business owners when it's not worth their time to go out and try to file an insurance claim that's then going to jack up the insurance or get them kicked out? But if they lost all their product in the cooler in the walk-in, or they lost ticket revenue from a show like Mayhall's did a few months ago, then what do? How can we support them? We might not be able to make them whole, but as a community we can say, we hear you, we see you, and we support you. How to open a small business and what needs done on a reoccurring basis. This is something Joe's dealing with every day when folks say, how do I open? What do I do? And then when I get to City Hall, where do I go? And what's my timing like? And what's the sequencing? I don't know what I don't know. So being able to lay all that out explicitly and clearly for folks is really important. Marketing is a constant struggle for business owners. I'm not really sure how we tackle that. A lot of them, some are better than others, and they're trying to figure out how to get the word out. Startup and continued funding for non-emergency. How can we support our startups? We used to have an entrepreneur in residence, Mike Balsito, many years ago. He would be able to sit down and talk with folks about, here's what you can do. Right now, that's what we're doing to a point. How do we do more of that? And then even though this is all COVID-related on the bottom, I wanted to share these. This is kind of a flashback to 2020, 2021. Matt Bixenstein put these together. And then the middle one was actually the graphic that the city, Lakewood Alive, and the chamber came together on in the Shop Safe Lakewood. It's just simply saying that when times are tough, or even when they're not, we're going to step up to try to help out small businesses. Next slide, please. My last one. Thank you.
Well, thank you, Ian and Joe, for coming. And I learned a little, knew most, but I think it's helpful to have, the forum for the community that watches these, and then also my colleagues to hear all of this great work. Any other comments or Councilman Evans?
Just quickly, I think it's important to realize, I've kind of been around the block a few times with working with cities and with not-for-profits like a CDC, like Lakewood Alive operates as. And this relationship that the city and Lakewood Alive have isn't the norm. I'm pretty confident to say that I think we have kind of the gold standard of how this kind of relationship can and should work. So we've built something special together, and I think that requires us to continue to invest in that to make sure it's as best as it can be. So I will certainly, continue to fight to find whatever resources we need so you can keep doing that work, because I agree with Councilman Baker. I think every dollar that we invest in Lakewood Alive, and not just the city, I'm talking about personal donors, corporate donors, grant makers, foundations, every one of those dollars we get more back for the community, for the good of the community than we put in. So I just thank you again for all the work you do every day out there. I think it's truly inspiring, and I'm glad we have such a great partnership with you guys.
Thank you.
Yeah, I often think about, there's a book about social infrastructure where it's not anything built, but it's more of I think our community, the density of it, I think our front porches, I think our walking corridors, I think a lot of the work that Ian and Joe do to help kind of force multiply what we have in the city, it literally creates healthier communities. Now, the need is still there, and the need is pretty drastic, and you look at those low-mod census tracts. It's all over the city. In fact, the one in Ward 1 I grew up in, and, there's a lot of need there. And so each one of those, and then there's need within census tracts that aren't low-mod. That's just the nature of our community. But I want to thank you all for coming. And there's one thing, and this is more of a point of order if there's no more questions for Ian, or does Director Byington have anything? No. I was supposed to read this at the beginning, but for Councilman Bullock's sickness, so he couldn't be here in person. Thank you for not getting me sick, Councilman Bullock. But pursuant to Lakewood Codified Ordinance 109.01B1, as chair, I called this meeting to be held by video conference due to special circumstances of the illness of Councilman Bullock. And under Ordinance 109.01C, Councilman Bullock need not be present for the purpose of voting for determining a quorum. So that's just more of a point of order. So if there's any other comments or thoughts from my colleagues, or Ian or Joe?
We appreciate the time.
Yeah, thank you for
long,
coming.
I know, but thank you for hearing us out. We appreciate this. It's important.
Tom always goes long, so he gets to be on the receiving end of that. So thank you, and I'll just go ahead and make a motion to receive and file this communication.
Second.
All those in favor say aye. Aye.
Aye.
Aye. And this meeting stands adjourned, and the chair of the Finance Committee can decide when to call his meeting.
Thank you.
I'd love
Okay.
3 minutes, though,
Why
Tom.
don't we take a 3-minute break or a 2-minute break? Okay? Everybody, I'll watch the screen for when you're back.
Hey, Tom. We just wanted to confirm that you're staying for the special meeting. We have a quorum issue.
Madam Clerk, was that a question for me?
Yes, we were just confirming that you're planning on staying present on Zoom through the special meeting
we're
coming
ready
up?
to go. I'm going to call a meeting to order. I can't see the administration's table. Is everybody ready in attendance?
Ready to rock.
Okay, thanks. All right, give me 1 second here. Okay, I'd like to call, pursuant to Lakewood Codified Ordinances 109.01B1, as chair, I'm calling for this evening's Finance Committee to be held partially by video conference due to the special circumstance of personal illness. Under Ordinance 109.01C, council members participating remotely need not be present for the purposes of voting or determining a quorum. So I'd like to call the meeting to order. There's a couple points I'll make. First, I'm going to be fairly brief in my remarks. I hope council members that will be in a position to approve and report out both matters before us tonight. Before I forget, the law directions there's a typo in the section 2 of resolution, the second resolution of the document, which is related to, well, let me just call it up. It's a minor point, but I wanted to get it so I don't forget it. Okay, section 2 of the ordinance 2025-60. No, I'm on the wrong thing. Hold on 1 second, guys.
In 2025-66?
Section 2 of Resolution 2025-65, properties are deeded to have been met. I think it probably means property are deemed to have been met. So deeded should be deemed, I think, in Section 2. Just don't let us forget that. Thanks. Okay. To the top of the order, we've got the presentation from Director Byington and Development Officer Wyman, and I think at least one of the co-chairs of the Citizens Advisory Committee to present us on what their recommendations are. Before jumping into that, council colleagues, do you have any questions or opening remarks you'd like to make? Okay. Why don't we proceed with the presentation? Thanks, Director Byington, if you're there, or Mr. Wyman.
I'll take it. My name's Dan Wyman. I serve as Development Officer in Lakewood's Department. I think it's on. No, it's not again. I'll start over. My name is Dan Wyman. I serve as Development Officer in Lakewood's Department of Planning and Development. I'd like to thank committee members for this opportunity to discuss Lakewood's federal funding sources and the annual Citizens Advisory Committee process through which these funds are allocated. It's my pleasure to introduce FY26 Citizens Advisory Committee Co-Chair Claire Foley and thank her for her service to our community. Unfortunately, Claire's Co-Chair Gail Davis is unable to attend this evening. Again, my sincere thanks to Gail and Claire for their active participation, leadership, and service to our community. As you see, the 17 members of this year's Citizens Advisory Committee are on the left side of the slide, and co-chairs Davis and Foley are indicated. On the right side is this year's meeting schedule. The committee convened 4 times in August and September, which is typical annually. 2 of those meetings, the first and the fourth, included mandatory public hearings. HUD requires that at least 2 public hearings be held each year during the CAC process. Although all of the meetings are made public and are open to the public and properly noticed. The committee reviewed funding applications and heard presentations from city departments and not-for-profit agencies requesting 2026 Community Development Block Grant, or CDBG, and Emergency Solutions Grant, or ESG funds. And finally, during its fourth session, the CAC developed 2026 CDBG and ESG funding allocation recommendations based on an estimated CDBG award in 2026 of $1.75 million, which is a bit lower than previous years, given statements by the current administration regarding decreased funding for federal housing programs, as well as an appropriation by the U.S. House of Representatives of $3.3 billion, which is level funding, the same as 2025, but a $3.1 billion appropriation by the Senate, which still needs to be reconciled. So given those variables, I thought we needed to be conservative in our estimate to make sure we didn't overshoot it. And it's better to kind of underpromise and be able to increase the allocations when we find out what the actual award is, rather than to overpromise and then have to decrease them. The next slide shows the Citizens Advisory Committee's 2026 allocation recommendations in the far right column. Also included here are each activity's 2025 allocation and each activity's 2026 funding request. What you see shaded at the bottom, the bottom 7 programs or they're called activities in CDBG parlance, are what are called public services activities. Those are shaded and called out because those activities may not exceed 15% of total allocations, which in our case would be 1.7, as indicated at the bottom of the slide, 15% of $1.75 million, which is $262,500. So if you add up on the far right column those 7 amounts, you will arrive at $262,500. We cannot allocate a penny more than that, given the $1.75 million. What happens if we are to receive a higher allocation ultimately is that those awards will be increased proportionally based on their original proportion of the $1.75 million. So if we receive $1.8 million, for example, the food pantry allocation would be increased to the whatever percentage of $262,500,000. $262,500,000 is their allocation. Sorry, the 81,045 that they would get under the original scheme with 1.75 million would increase to that percentage of 1.8 million. So, and that would happen across the board for all of those allocations. So that's how that would work. The CDBG administration allocation at $350,000 is also subject to a cap by HUD, and that is 20% of the total allocation, which is necessary given the year-to-year carry forward that we have remaining in that account, which is minimal. So we do need the full 20%, which is $350,000 of that 1.75 million, in order to properly administer the program. The street improvements allocation is $850,000. We are, for the first time ever, funding public art through CDBG, which is a nice thing to do. It's a little different than anything we've done before. At $42.5, we typically, year in and year out, fund building code enforcement. Sometimes it's a bit higher, but this year, given the year-to-year carry forward, it's $65,000. Our affordable housing programs are recommended to be funded at $75,000, which keeps them at a viable funding level. Lakewood Alive's paint rebate program, because they had a large carry forward year to year for a couple of years had not been funded in 2025, but we have actually increased their funding substantially from their typical 42,000 to 75,000, which is a nice thing to be able to do. And finally, CDBG regulations allow for the facilitation of the delivery of the home program, which the city also receives home funding. So we often allocate funds to facilitate the delivery of that program, and we are doing so in 2026, at least recommending that at $30,000. So I can answer any questions council members have about these allocations after the presentation. And next, if I can advance this, it's a much simpler, straightforward proposition here. The committee's recommendations for emergency solutions grant funding, which are very similar year in and year out. The only organization in the city that is capable of and experienced administering ESG funds is Lakewood Community Services Center, or LCSC. And they used to operate two programs that were eligible: an emergency shelter and a homelessness prevention program, because when they moved their headquarters to the former city youth building, they were unable to continue providing emergency shelter services. So now they provide just one ESG eligible program, which is homelessness prevention, which is basically rent and utility assistance. So $155,000 of the $160,000 estimated award, CAC recommended to provide for homelessness prevention services, and the city typically utilizes $5,000 every year in ESG funding to administer the program itself, which is substantially below the statutory cap of 7.5% of $160,000. I'm sorry, but I guess that's the end of my presentation because there are no more slides. So, you know, I fooled myself there. Anyway, thank you very much for the opportunity to present these recommended allocations to you. And if you'd like to ask me or Director Byington or Co-Chair Foley any questions about the process or the allocations themselves or anything else about the CAC, I'd be happy to
Co-Chair Foley, would you like to say a few words? And thank you for your service.
Oh, sorry, it is on. Sure. Thank you for having me and allowing me to be engaged in this process. In talking with my co-chair, Gil Davis, before the session, we kind of drafted a little statement that we wanted to say about how the process went this year. And our recommendations were in line with the city's for how to fund these important programs. But we'd like to convey that this group thought very critically about how these funds should be used to serve Lakewood. It's our experience that Citizens Advisory Committee members are often highly engaged and invested in their role on this committee. This year, some members of the group expressed a desire to be more engaged in the overall process in ways that extend beyond their current responsibilities and existing structure. This is unsurprising given the genuine interest of the typical committee member in making meaningful change in our community. While we haven't made any changes to the CAC as a result of this conversation, we may spend some time in the coming months exploring the kinds of changes that the committee could make to increase engagement and their feasibility. We're proud of these recommendations and hope that they are adopted and can serve Lakewood citizens well.
Well, thank you, and very well stated. I appreciate that and agree. Thank you. Director Byington, do you want to mention anything, or can we open it to council members?
Thank you, Chairman Bullock. I don't really have much to say, but I just wanted to thank Mr. Wyman. He does such a great job, and the CAC as well, and I appreciate their time reviewing these recommendations. And I'd also like to say that I am excited to see that the recommendation for public art came through. As Lakewood Alive explained, you know, it's a great program, and the residents are loving the projects that are happening right now. Thank you.
Thank you. Mr. Wyman, just a clarification on, you know, if affordable housing is such a priority as it is for our town, and it's increasingly difficult to pull off as it is today, wouldn't we want to invest more in the affordable housing programs under community development in the home, presumably, I think the home activity delivery also? You did a helpful job of refreshing your memories on the paint program. Now, I think what you're going to say is we base our allocations on observed caseload trends, which are a little bit meander up and down, but you can do a pretty good projection. And then there's income limits for qualifying for these programs. So if we had the money, which we don't, to triple or quintuple those levels, wouldn't we want to do that? And your answer is?
Of course we would. Given an unlimited budget, we would love to be able to provide and fewer restrictions on who can use the money and how we can use it. We would obviously allocate more. The $75,000 funding level in 26 is really based on the fact that we have a certain amount of program income that comes in for the low interest loan program, which is appropriate or even more than sufficient in 26 to fully fund that piece of the affordable housing programs that we offer. And the ramp or repair, accessibility, and maintenance program, weatherization assistance program, and home improvement grant program, which are sort of the other non-revolving loan funds that we administer for affordable housing. Those three activities combined also have, with that infusion of $75,000 in 2026 funds, have a more than sufficient funding level to, given what you said, given the sort of pace of projects, which has picked up enormously over the past 2 years under Marty Castelletti's leadership. So,
great to hear.
You know, the volume of projects dipped during the pandemic, obviously, and then really through the middle of 22, and Marty, who has been, you know, in construction as well as administering these types of programs, is really a great project manager, and he has really increased the volume tremendously. And so, even given that increased volume, the $75,000 really does enable us to maintain this increased level, have enough sort of buffer at the end of the year so that we can continue to allocate, let's say, $75,000 to $125,000 a year and keep things rolling.
Okay, so your point is we are at max pace, and so what that number represents is Lakewood City government is all in on supporting affordable housing, or is it more like we're doing what we can afford? Sounds like we're all in.
I would say the former, and remember, we also have significant home investment partnerships funding that is not discussed during this hearing. It's just separate and apart. We received that as a member of the Cuyahoga County Housing Consortium, and the annual allocation it fluctuates between, let's say, $175,000 and up to $275,000 a year. That money is more difficult to spend because we can't do the types of projects we do with CDBG, smaller homeowner-based or 1 to 3 family projects. That's the kind of project that we've discussed with council in the past. The Nelson Court projects, those side-by-side 4 to 5 unit conversions that we've invested $800,000 in over the past several years. That will be, the second building will be completed in 2026. and 1472 Bell Avenue, which was recently completed, the council just recently authorized the sale of, that we invested about $422,000, I believe. That is another way that we are all in on affordable housing.
Okay, well, obviously, if we addressed all affordable housing, the budget would be much larger, but it sounds like the bottleneck is not our funding investment as much as the criteria for these programs, right? The
I wouldn't even call it a bottleneck. I'd say that it's, I mean, I don't know that we have the capacity to hire a second person. We've been at this staffing level for many years now, and that's not quite feasible. So I think that we are doing a tremendous job with the staff that we have.
Yeah, that's great to hear. But if we had more staff capacity, we would have more throughput on these projects.
If we had more staff, we'd do less projects probably because we'd have far less money to do projects. We'd have to be paying.
That was the question I was asking. If we had staff and the money to back it, we could get more done. Is that true?
Certainly. Yes.
Okay. I didn't know that, so thank you for answering my question. Okay, council members, sorry for hogging the mic. Council, I'm going to go to committee members first. Councilwoman Streebig, do you have any questions or points?
Sure, I do. Could you go back a couple slides and show me the history again with the allocations? That's the one.
That one.
Yep. And I absolutely understand why you would be conservative with this administration. Can you talk about a little bit about the time frame and when you're expecting these numbers to actualize?
Oh, that's a great question. It was difficult to predict under normal circumstances, and I would call these not normal circumstances, I guess, given the shutdown, which looks like it might be soon, ends, imminently, if you've been kind of following the news, which has delayed things beyond what they usually are. But HUD works in a very peculiar way. So we don't find out what our current year allocation is sometimes until July or August, once in September of the current year. And that means when we find out, and that they just tell us, and then pretty quickly after that they send us contracts, right? And so within a day I get the mayor to sign contracts, send them back. Now typically they send us a signed contract by HUD, and the mayor signs, and they're fully executed. This year they sent me an unsigned contract a while back. I had the mayor sign them and send them back, and then the shutdown happened. Mm-hmm. So this year, we still are waiting. So it's now November 10th, and we have not received fully executed contracts, nor have our funds been deposited. I was discussing this with Renee not 45 minutes ago. I believe that we will receive the funds, assuming the shutdown ends. HUD sort of kind of gets through whatever backlog they have, it will be signed, and those funds will be electronically deposited in our account with time enough for me to recoup all the funds that we've advanced before the end of the year. That is, I think, realistic. This is an outlier this year. Typically, we will find out, like I said, the earliest maybe June, at the latest August. So that's what we're working with on an annual basis. So it's really there's a huge lag.
Thank you. And my concern is, have you been conservative enough if there's much of a lag?
I have been. Yeah, I do. I mean, I think it's truly based on what I spoke of earlier, which is the House is publicly approved an appropriation of level funding, which would keep us at the same level we were at last year, which is 1.83 million. And the Senate is 200 million below that. So I went conservative. I do worry about the administration getting involved and trying to knock everything out and down.
Too.
So, yes, I mean, but that, I just think that 1.75, given my 15 years of experience doing this, I understand that everything now is kind of up in the air and and anything could happen. But that was my best estimate based on my experience and what I try to keep current on with regard to what's going on at the federal level.
Thank you.
Yeah, Councilman Bullock, I have a question, if that's okay. I assume it is. Thank you. I'm always, I had a little experience prior to my time on council working on the board of Camps Corner Development Corporation, and I'm always appreciative of the way we do our CBD funding here in Lakewood as opposed to our neighbors to the east. And I think it really shows a good process, and it gives a lot of certainty to the partners we work with. So I really appreciate it. The one thing to Co-Chair Foley, you hinted at kind of some suggestions that that you guys might have for the process. That's really not in front of us here. This is the appropriation, but I'm curious if you're comfortable sharing more of what you meant by that.
Sorry. Yeah. We have, so our current process is we hear proposals from a number of organizations. Our final meeting is us kind of deliberating and coming to a decision about how much funding we'll give each organization. And between the end of proposals and that final meeting, we also get a recommendation from the city about that is filled with nuances and experience and expertise steeped into it. So we take that very seriously. It's compressed into 4 meetings, however, and while we haven't kind of thought about or iterated about what a deeper engagement might look like, there was desire to do that. Of course, the last meeting we had to kind of get to that recommendation. So that conversation that I hinted at had no conclusions or even suggestions. It was just more of a desire to understand if there was a feasible way to become more involved in the process beyond those 4 really highly engaging meetings in the fall. So no suggestions, just a question about what's possible and feasible.
Thank you. Yeah, and I've heard similar feedback, and I think it's one of those things where every process can be improved. I think that there's no process out there that can't go with some improvement. And so, but I guess, as the policymakers for the city, interested in, and I know Gail Davis as well, and some of the other CAC members. So I think we could probably deep dive a little bit more into that. I am curious as the allocations, how did you come to the numbers? Was it like basically a percentage of each one? Like, so 81045, is that what the administration recommended for food pantry assistance, or did you guys run some numbers on that?
These are exactly in line with the city's recommendations.
Okay. All right. Thank you. I understand. No further questions, Chair Bull. You okay, Tom?
Yep.
All right.
Any more questions from Councilman Baker?
No, I just want to thank the administration and Co-Chair Foley for your work here. It's
okay. I'd like to open it up to other council members. Councilwoman Streebig, Councilwoman Marks.
No comment from Councilperson Marks.
No comments.
Okay. Thank you. Councilman Evans?
Yeah, thanks. My questions were actually answered by, or asked by previous folks, so I'm good. Thanks. And thanks for
Okay,
all the work.
thanks. Councilwoman Hamilton Steiner.
Co-Chair Foley, I think that it is commendable that you and the group came up with a way to improve the process and get more engaged. I served on Charter Review Commission, and we felt the same way, in the sense that like you have 6 months to essentially do some deep diving and to do a lot of work, and it just was like not enough time, but that's charter bound and all that stuff. So, and I'm not, and I should know the answer, but I probably have to dig a little bit more and see if, or if anyone, or if maybe Chair Baker knows, if the CAC, if that's charter bound, like the 4 meetings, or is that ordinance, or?
I think it's either ordinance or resolution based, but I defer to you.
Okay, so, yeah.
So, it's interesting. Perhaps Maureen can help on this. I tried to do kind of a deep dive into the establishing legislation for the CAC. References to the CAC go back to the mid-'80s in the archives, but I cannot locate, maybe Maureen could help, establishing legislation for the CAC itself. Like, what is definitive is that, and I have some notes here, on this very subject, that Resolution 71-2496 establishes Lakewood Citizen Participation Plan, which is a HUD-required plan. It's based on 24 CFR 91.105, basically requiring every community that receives CDBG funds to adopt a citizen participation plan that has certain parameters, pretty general parameters. HUD does not require any community to have a citizen advisory committee. That is not a requirement. Most CDBG recipients decide to utilize that type of committee as the vehicle to implement its citizen participation plan, which is what Lakewood does and has done since the mid-'80s. And the most detailed description of what the CAC is and does is included in that resolution, the exhibit to that resolution, which is the plan. And really, it's very, I mean, it's pretty straightforward and simple, and it just describes who's on the committee, who appoints who and for how long, how many meetings, but it's pretty definitive on the committee's, advisory role to provide input, and that ultimately, obviously, it's council that makes, that ultimately makes and approves allocations. So it's, that's really, so if you, I'm not going to, I won't give a chapter and verse, but Resolution 71-2496 is really where all of the information about the CAC exists and where it is defined.
Can you send that to council, or can the clerk's office? I've never and sorry for jumping in.
No.
Yeah, I've looked in our code, and our code references the CAC, but it doesn't reference the formation of the CAC. It just references it in targeted areas or targeted deteriorating areas.
One further point, that the only intentional change to that plan and to the CAC itself was in 2020, when the pandemic required us to amend it to suit some virtual, activities. Other than that, in 29 years, there hasn't been any organic movement to make any changes to the plan or to the CAC's remit or purpose or the scope or breadth of its activities. So,
No, thank you. So I guess I'm just supporting Chair Foley and Chair Davis and the group in wanting to be a little bit more engaged and connected with the organization. It seems like the organizations that are coming requesting the dollars and maybe have a little bit more hands-on sort of in shaping that, and especially since council ultimately gets to approve that, if what I'm hearing the citizens want to be more involved, I would definitely want to support that, and that totally tracks with our community and wanting to be involved in what we're seeing with CASE and just wanting to be more involved and engaged and connected, which is always great because that just keeps us a healthy, thriving democracy. So I support it.
Thank you. I'm going to start moving really quickly here. Actually, Mr. Baker, since I can't find the right screen, can you make a motion to approve or recommend for full adoption, if you're willing, this resolution to the full council?
Yes, I will make a motion to recommend full adoption of Resolution 2025-66.
Second. Motion's been made and seconded. Any discussion? Hearing none, all in favor say aye.
Aye.
Aye. Opposed? And the ayes have it. Thank you. I'm trying to do this in 2 minutes. Mr. Baker, I hope if we need 3 minutes, we could take that liberty. So the next item is Resolution 2025-65. Is the law director there?
Yes, I'm here, Mr. Chair.
Okay. Did my typo correction make parse for you? All provisions of the codified ordinance with respect to the sale or lease of the city-owned property are deemed to have been met. So I could make a motion to change deeded to remove or strike deeded and replace it deemed.
Yes, sir. We apologize for that typo. Thank you for, identifying.
Yeah, no big deal. So do you need me to make a motion? Or can that be? I'll just make the motion. I'll move that the word deeded in section 2 of the resolution be stricken and replaced with the word deemed. Is there a second?
Second.
Motion's been made and seconded. Any discussion?
Yeah.
Hearing none, all in favor say aye. Aye.
I recuse myself on this vote, Council. Even though it's a procedural matter that you're bringing up, my wife's on the board of the organization the city is seeking to amend the lease of the property to, so I'll abstain. Sorry.
Thank you. Your abstention is noted. So we have 2 yes, 1 abstention. That motion carries. Very briefly, I support this resolution, and I guess my request is to Councilwoman Schriebig, are you comfortable tonight referring this out of committee? I think that would be helpful to both the city and the tenant. This is for the Lakewood Child Care Center's lease. They're a 5-star, which is hard to do for years, credited child care agency. They have rented for years in first a hospital-owned building that transferred to the city about 10 years ago. And if we were to agree, what this would do is position that child care agency to have some long-term confidence as a tenant that they'll be there for a while, and therefore they can make improvements and investments to expand, and I believe add the number of infants they can care for, which is the hardest to do or most expensive per capita. So since they're a tenant, there's a split incentive between, hey, I'm renting, I don't own the facility, so I could get kicked out. So does it make sense for me to invest in something that'll take 10 years to pay off? Well, I think this new lease terms would resolve that. Director Byington, is that a fair statement?
Yes, it is, Chairman.
Okay. So I guess my confidence in this, that on both the tenant end, they're of superb quality. They provide much needed service in town, which is to provide affordably priced and high quality health care at a convenient location, and something we care about, right, in town. And second, we lost this tenant, that would take a significant blow to the supply of quality health care in town. Third, we're in a position as a city to have some say in this case directly, whereas pick another building we don't own, well, it's up to that property owner, is free market. So we essentially can renew our commitment to this priority, and that's what makes sense to me. So I'll stop talking. Oh, and I've also had a chance to confer a little with the tenant, and they're affirming that what Director Byington already said, that they agree with the terms put them in a strong position for the long-term growth. Councilwoman Schriebig, I can't ask your colleague on this committee questions, but any thoughts?
Yeah, thank you, Chair Bullock. I did want to ask Director Byington a question about the tenant improvement allowance, and if you could explain that a little further. And I did read through the contract and the carryover each year, but I was wondering if you had any ideas of what they were planning to improve, if they're planning to build out, or is it an interior remodeling, or if you could shed any light on that. Thank you.
Certainly, through you, Chairman Bullock. So, as you know, we have the North Point Realty. They are the liaison, the management team for this property. When improvements need to occur at that building, they're responsible for bidding it out or getting the quotes and moving forward. However, the Child Care Center would like to do some interior work, and like Chairman Bullock has mentioned, they want to make improvements that are more long-term. So they're putting together their list of what they would like to do, and that's why they would like to carry over the money when necessary some years to have a little larger projects. So it starts at, let's see, I think it was $15,000 a year to start with, for so many years, and then it increases. But they haven't talked about doing a large build out. There is an opportunity on the second floor for them to expand, and we have not come to any sort of agreement or negotiated on that yet. So that might be something that the tenant improvement allowance could go towards. But essentially, they just want the ability to move faster and do painting, and if they need shelves, minor renovations as needed moving forward.
Thank you. Is there anyone on the second floor right now?
There is not right now. The clinic had vacated the second floor when we've had some discussions internally and with the Child Care Center about a possible lease in the future, but we're not to that point yet.
Thank you. And thank you, Chair Bullock. I am ready to support this amendment.
Okay, I appreciate it. So I'll make a motion to recommend for adoption to the full council Resolution 2025-65 is amended.
Second.
Motion been made and seconded. Any discussion? And I will call for abstentions as well. All in favor say aye.
Aye.
Aye. Opposed? And abstentions?
Abstain.
Thank you. And the ayes have it. The motion carries. Director Byington, I want to say in particular thanks to you for your diligent work on this and responsiveness. You and I have been conferring, 18 months here and there, but you've been really thoughtful in this, and I appreciate it. Okay, without objection, the Finance Committee is adjourned.
Thank you, Councilman Bullock. I will just go ahead and move into the special meeting. Be respectful of everyone's time. So I will go ahead and call to order the special meeting of council for November 10th, 2025 at 8:21 p.m. Pursuant to Lakewood Codified Ordinances 109.01B1, as the presiding officer of council, I am calling the city's council meeting this evening to be held by video conference due to special circumstances of the illness of Councilman Bullock. And under Ordinance 109.01C, Councilman Bullock need not be present for the purpose of voting and determining a quorum. So with that procedural matter out of the way, we only have we have a communication and a resolution on the docket. So the first order of business is a communication from Director Byington regarding Cuyahoga County Community Development Supplemental Grant Program, Madison Park Futsal Court Renovation Project.
Thank
Director
you.
Byington.
Thank you, Councilman Baker. And thank you so much for accommodating us with this last-minute meeting. We appreciate it very much. The attached resolution authorizes and supports an application for grant funding through the Cuyahoga County Community Development Supplemental Grant Program. This is a competitive award program offering grants up to $50,000 to help strengthen cities, encourage regional collaboration, and improve quality of life for county residents. Funding this grant is provided from the county casino tax revenue. The city is requesting $50,000 in grant funding to support an estimated $300,000 project for renovation of the existing futsal courts at Madison Park. The courts were originally tennis courts that were converted to futsal courts 7 years ago. The courts have been very popular and are supported by programming through the Recreation Department. Additionally, children and adults utilize the courts for open play when leagues and lessons are not in session. These futsal courts, through numerous public meetings during the Madison Park master planning process, have been identified as a priority recommendation in the Madison Park master plan that has been adopted by City Council. Among other items, the grant application requires that City Council adopt a resolution acknowledging the grant is being applied for and that a notice public meeting about the project for which the application is being submitted has occurred. The meeting occurred October 21st, 2025 at Madison Park. Previous resolutions of support for this grant opportunity have been passed on first reading. The grant submitted was November 6th with accompanying legislation due no later than November 14th. Due to the late release of the grant application this year, the timeline for the required public notice, CDBG public meeting, and council approval have been shortened. City Council consideration of first reading approval would be appreciated. And just further, we've had been successful with this grant the last 2 years. We did the Bird Town Connector project and Madison Park Playground.
Thank you, Director Byington. I'll go ahead and make a motion to receive and file that communication.
Second.
Second by Councilperson Strebig. Any discussion from council members? Councilperson Strebig.
Thank you. I was able to attend the October 21st meeting at the futsal courts, and I had a chance to see the coaches and the skills of the children, young people playing futsal on the court, and it was impressive, I have to tell you. I played a little soccer when I was a kid, and this was not that. I mean, this was very impressive. So I am anxious to see where these young people go with these skills, and I'm very much in support of this. Thank you.
Thank you. Any other comments? Councilperson Marks.
Thank you. I'm always in favor of any improvement at Madison Park, so I'm fully in favor of this. Thanks for all your hard work to make this work.
Great. I guess on the motion to receive and file, all those in favor say aye. Aye. Councilman Bullock, can we get an aye?
Aye.
All right. The ayes have it. And then the next order of business is Resolution 2025-69. I guess Maureen typically does this, but I guess I'll just do it. A resolution to take effect immediately provided it receives the affirmative vote of at least 2/3 of the members of council or otherwise to take effect at the earliest period allowed by law, authorizing the mayor or the director of planning and development to apply for the Cuyahoga County Community Development Supplemental Grant Program for a $50,000 grant and for the grant to be used in the renovation of the existing futsal courts in Madison Park, and the project will be titled Madison Park Futsal Court Renovation Project. I will go ahead and make a motion to approve that resolution.
Second.
Councilperson Strebig beat Councilperson Bullock, so she is now the second. Any comments or from the rest of my colleagues, administration? No. All those in favor say aye. Aye.
Aye.
Councilman Bullock, aye as well. Passes. Thank you. No further business coming before council. This meeting is hereby adjourned.